I mean, I'm an ambassador for British Heart Foundation because I have chronic heart disease, which sounds a bit odd, but I was born with a leaking heart valve, an incompetent aortic valve. So my valve lets blood back, so the blood goes out the heart, but then some of it comes back, so you can hear the leak. It wasn't discovered until I was about 11 years old, and ever since then I've been under the observation. In fact, funnily enough, just had a phone call from my specialist this morning, just to check up on me and arrange for me to go in. So yeah, it hasn't caused me any obvious problems. A couple of scares, but not related to the heart. But it's something I have to respect, and especially as I get older. When I was an athlete, it was there the whole time. Of course it was, but I was putting my heart under a lot of stress. But so it was a concern. But for me, it wasn't going to stop me doing what I was doing. Now I'm 55. I'm getting older, and I'm much more aware of it. I don't have any problems, but I'm much more aware of my condition because clearly I have to respect it. I think if we're going to improve medical solutions to problems, then we have to have research, and we have to have people who are willing to who fit the criteria, who are willing safely to take part in those practices, because it's the only way we can improve the drugs, improve the treatment. So yes, I absolutely think, and I would, if it could help somebody else or help a future generation. And we've seen so many breakthroughs that come through the testing. And what I like about the testing is to actually qualify to be part of it. Say the heart, if you're doing tests around heart conditions, you have to really fit the bill. So they're very specific about who should do what, and it's done very safely, and it's monitored very, very carefully. But if we're going to improve drugs, if we're going to improve treatments, then I guess human beings have to be part of the process. So, it was the process of having the health check at the Panthera clinic for me was very enjoyable. It was done very professionally. It was done. Every part of the system was monitored. Every note was taken. It was very well explained to me by the doctor. I thought the communication process was excellent. So I had some blood taken from me because they were looking for certain levels of a certain substance in my blood. Now I didn't pass the criteria because I was actually fine, so I wouldn't move on to the test process. But yeah, I think what was good about it was the environment was nice. But I think the most important thing was the communication. I understood exactly what was being done. I understood why it was being done, and when the results came through, I understood why I didn't qualify to go on to the next level, because fortunately for me, I was pretty healthy. So I had my test done at the Panthera building in Enfield in London, in North London. So for me, I lived south of London. It was very easy. I took the train up to London and took the train through London, and the Ponders End train station is a minute's walk from the Panthera building. So it was very, very easy. Once you get to Ponders End, you go to Tottenham and then Ponders End. So very easy to get to, very accessible. Nice little cafe next door. Yeah, very nice. So I went in, met the team there. Everyone, the key was the communication process. I think if you're communicated well as to what's happening and why it's happening, and what, they're going to have your blood pressure taken, you're going to have some blood taken, you're going to measure your height, you're going to measure your weight. It was just explained very well why I was there and what they were looking for. So yeah, very easy to get to from my perspective, and the communication from every member of staff was first class. But I think for a lot of people, the reason you do it is that you want to help other people in your situation. You want to improve treatments. You want to be part of it. And because of whatever condition you have, if you qualify for that test, then you really can make a difference to future generations, but also to even yourself. I mean, I know people have discovered things by having the full health check they didn't know happened. and as a result of that, they've coincidentally sort of improved their health. So I think if you're interested in the process, if you're interested in the advancements of drugs, the advancements of treatments for certain conditions, then I would give it a go. I would go along and ask some questions and see if it's something that you would be able to qualify for, because it's an interesting process, and clearly you're helping other people.